welcome to the Heritage Hotel here in Portlaoise for our first EngAGEment with Bluebird Care event of 2014. What we have found from going around the country is that people appreciate the opportunity to have their say on the issues that affect them.
We are all living longer. We, population-wise, are all living longer, which is a good thing. The numbers who are sick as a percentage are actually reducing, so it's not all kind of doom and gloom, okay? More healthy people are being delivered into their 80s and beyond.
I mean, Bluebird Care, it's about keeping people at home. And I mean, nursing homes have their place, but I think when people can stay at home, they have their comforts, they have their family around them, they have familiar things. And I mean, we have brought a couple of people home from nursing homes and we've noticed a huge improvement.
One of the key factors you can alleviate, as Dermot said, is to build up your social networks, to maintain friendships and relationships. But we're living into our 80s, some people in their 90s.
It's very difficult to get men involved in these kind of things. There's an interesting phenomenon in Italy. I go there on holidays now and again, and I often see in the morning all the old senior men will come down outside the church and sit on chairs outside the church, and they'll sit there and talk for maybe 2 hours every day.
There's 600 different housing charities. If you look at that, and like while we all are members of the Irish Council for Social Housing, there's no actual joint up thinking regarding social housing.
I think the most important thing is there's no such thing as older people. There are 500,000 people over 65, right. All of them different. Some very wealthy, some very poor. You never hear we've got too many children, too many babies, but we've apparently got too many older people.
And people who have paid into their pensions all their lives have seen them hit. Now, they have paid their pensions all their lives, and the public service pension was actually running at a profit up until the crash. And that is money that was deferred salary that people paid into their pensions.
The thing, I think, and which I tried to tease out just a little bit here tonight, is this generation of us has fantastic skills. Skills that are lost to the next generation. If your self-esteem is such that you're saying, you know, I can't do it anymore. The only thing you can't do anymore is run the 100 meters in 12.4 seconds. Now, every single person in this room is an expert. Believe me, because you have talents way above what the average people in this population have. So therefore, find a way of using them. Don't atrophy. Don't be afraid to get out of bed. Use them.
There's 230 million spent on home help hours a year here in Ireland by the HSE. It's not enough. A general HSE package, whether it be delivered by not-for-profit organisations, HSE direct, or by private providers, the general thing is 5 hours a week. And that really is what it is.
But 5 hours a week isn't even every day.
No, so, you know, a lot of people will supplement that with private care as well. George, I want to thank you on behalf of Bluebird Care for coming down here this evening and for hosting this, and to everyone who came, thank you very, very much, and I hope you enjoyed your evening.
I found it rewarding. I found it knowledge. I learned so much from it. I enjoyed George Hook immensely, and all the speakers, they were so knowledgeable, and I feel it's something that is so important. I mean, I'm heading in that direction myself, and the fact of there was so much talk about being active. I found that just enlightening.
What did you think of the event?
Very interesting, and it should be held more often.
Well, one of the bigger issues raised was the fact that older people have full control of their own health, their own activity, and they can lower the risks for diseases like dementia, Alzheimer's, by taking control of their own lives and being active, being healthy. And that's where organisations like our own Inactive Retirement come in.
I'm very encouraged that we had a full house yet again this evening, which is fantastic. I think that the discussion has moved on since late last year. People are still very worried about what's going to happen to them when they get older.